Thank you. Thank you for inviting me today. There's a delay on this, I think, so I'll make a start. Yes, there is. Okay, I'm Kate Dale, and I work in Bradford District Care Foundation Trust, and I'm supported by the Yorkshire and Humber AHSN to do my work. And my main focus today is a little bit different, really. I had to become quite friendly with technology. So I'm a nurse of nearly 40 years, and very much on the ground. Never been a manager, never been a team leader, just a nurse on the ground. And I became quite passionate about the physical health of our patients around about 16 years ago. And I'm not going to labour this point, but our patients with serious mental illness are likely to die up to 20 years younger than the general population. And the main cause for this is cardiovascular disease, endocrine disorder, your diabetes and respiratory failure. And these are preventable diseases. And I found it astonishing that in this day and age, I'm showing my age here, but I'd worked in the older asylums where I'd seen quite good physical care, believe it or not. And as community care came in, I've watched the deterioration in physical care of our patients. And what we need to do is improve on this. So I set ahead to do what I'm going to say now was a proper piece of work. It may not be perfect, but it's what I felt like was a proper piece of work in order to demonstrate that I could go to bed at night and sleep. Diagnostic overshadowing, very briefly. My admission to this is I'm a CPN, I focus on the neck up, and I assume that a patient's thirsty because the drugs are making the dry mouth. When in actual fact, when I took the trouble, the patient had a random glucose of 23 and that patient was nearly blind. That's my hold your hand up. These days, I'm not going to go into detail here, but QOF is what pays GPs, and unfortunately the parameters do not cover any prevention of early death in our patients with serious mental illness. So I looked at the NICE guidance, which is the best way to go forward with this, and I knew that I wanted to be fairly blinkered within my work, fairly standardised, fairly simple, straightforward. We're talking about practice nurses and mental health nurses needing something that's straightforward and not time-consuming, but yet would pick up on preventable diseases and deaths. I also wanted to know that we could work both in primary and secondary care. There's a great deal of debate going on about whose responsibility it is. Well, I will say today, and stand by this, it's everybody's business, whether it happens in secondary or primary care. We need to make sure our patients with serious mental illness gain a physical health check appropriate to their illness, and not just annually, but regularly. When I did a quick snapshot audit across Bradford and Airedale, not one patient had had a cardiovascular risk score on that time, and not one patient had a prolactin level done, sorry. It's a bit of a pit stop, is this, so please forgive me if I'm rushing. We developed initially for System 1, and as I say, I had to become friendly with technology. At the time, I didn't realise that Morrison's didn't speak to Sainsbury's. And you'll all smile. So in my organisation, we were on Rio, and the primary care were on System 1, and they don't talk to each other. So initially, we created it for System 1. We moved on to create it for Rio in secondary care. No, there's still a massive interoperability issue, and we're not through that problem yet. But if you come to my table, I'll explain more about that. We've created it for EMIS. Now, EMIS and System 1 are now available nationally, and we have proved that we can replicate this template. It's information, it's intervention. We don't need to get precious about it. Everything's in line with the Leicester tool. That's what the screenshot looks like for the System 1 version. I'm not going to harbour on that today. We've rolled out across numerous sites in the UK now, but the main hub is Bradford District Care Trust and Airedale. We've made sure that all our nurses in secondary care have a framework for training, and we can differentiate between bands 2, 3 and 4, for example, for credibility in terms of you've got evidence for what you do and what you're capable of doing. Our qualified nurses and doctors have all trained within the RAMPS, which is the Recognising Assessing Medical Problems in a Psychiatric Setting. And if you Google that, you won't regret it. It's based on real serious untoward incidents that have happened on wards where patients have dropped dead from a physical health causation in a psychiatric setting. It's absolutely brilliant. Everything we do is standardised and systematic. Okay. And thank you very much.